Welcome to the continuing education module on strategies for wellness advocacy, making a persuasive case. Our agenda for this module includes the following topics: why the need for advocacy, fundamentals of wellness advocacy, potential obstacles to wellness advocacy, suggestions for effective wellness advocacy, and a summary of key points. Why the need for advocacy? First of all, wellness is countercultural. Our entire culture is really oriented not to wellness, but to illness and to doing things that are gratifying and not expending much effort. So wellness really is a countercultural concept, and that means we have to have more advocacy around it. Wellness is not required by anything. In fact, it's prohibited from being required even in the ACA, which was a highly partisan healthcare reform bill. So the basic issue is that wellness is not required. So it's an option for people, it's discretionary, and when other pressures take place, it gets pushed out of the way. Wellness is rarely generating revenue. And that means that it's not likely to be something that is seen as a business development opportunity for organizations that are about the business of raising revenues, increasing revenues to be able to grow and become stable and to provide better services. Wellness itself is fairly complex. So if we look at all the behavioral theories and the issues around long-term behavior change and habit formation, wellness is a fairly complex situation. Wellness is highly personal. So a lot of the issues in wellness are not the same across the population. They in fact are unique for each individual in that population. Wellness is neither trendy or politically correct. So it doesn't fit the bill of being something that is going to be routinely just accepted or supported. And wellness is difficult to do. In addition to being complex, if we want to bring about long-term behavior change around wellness topics and issues, then it's a difficult situation, it's a challenging situation. And wellness is very much needed by our population. We're going to talk about a number of reasons why it's needed, but the basic issue is that there's a lot of ill health which occurs in our society because people are not making the individual daily and lifestyle choices that contribute to a healthier and a higher level of well-being. So in summary, these are some of the needs that exist for advocacy around wellness that are operating in virtually all environments. The fundamentals of wellness advocacy include the following things. If we look at the basic sales process, if we break it down, it's essentially three major steps. The first one in all advocacy efforts and sales efforts, advocating a product, advocating a concept, advocating a position, advocating a choice of person, advocating a political agenda. It includes beginning with identifying the rationales for wellness that best fit your situation and your organization's top goals and cultural values. So you are attempting to take the concept of wellness, however you describe it and define it, and then compare it with and fit it with your own organization's purposes and the cultural values that guide it. Secondly, in the process is once you have identified those rationales for wellness, you want to pull together the compelling evidence that wellness delivers desired results with low risk. So that's what you're about doing, is really looking at the compelling evidence, putting that together, and being able to show that it can be done without increasing or significantly enhancing undesirable risk of any kind. The third step in the fundamentals of wellness advocacy are creating forums to present this message to key stakeholders in a simple way, attuned to their known biases. So that just means that we have then gone through the identification of rationales, we pulled together compelling evidence that support those rationales. We then are going to be looking for forums to present the message in a simple way that is attuned to their known biases. And that means we have to address issues to resolve them that may in fact be blockers or may in fact create challenges to the adoption of a wellness program or a wellness concept or value for a given culture. So in summary, these are the three major issues that are at the core of any advocacy effort around wellness. Now, the reality is that only about 20% of populations are intrinsically motivated for wellness. So we have a good deal of evidence that that's about the number that are usually interested in wellness if you raise the issue in any working population. And our real challenge is how do we reach the other 80% that are not intrinsically motivated for wellness? And by the response that we recommend at the WellCert program and the Chapman Institute is you look for ways of structuring incentives to create the extrinsic motivation to engage. And we have 25 different pay values that we can use in structuring those extrinsic based incentives. So we see incentives as a major tool to get that other 80% actively engaged in wellness. There's also a lot of opportunity for advocacy. If we look at the risk factors in virtually any population, we look at national data, we have a number of people who can benefit from some intervention around a specific health-related risk factor or behavior that has risk. So these are just some of the data from the National Health Survey. So we have lots of opportunities to express advocacy around specific issues and then crafting those together into more of a broader-based wellness or well-being approach. Now, the adoption of wellness is also affected by the patterns, which we know from the literature and from the science that's been done around this adoption of innovation, that there are these 5 major groups. The early innovators, and that's about 2.5% of most populations. Early adopters are another 13.5%. So that's the 2 groups by themselves are the ones that we oftentimes will do wellness first in a community, in an organization, in a setting of governmental agencies. There's usually this kind of pattern where you get about 15% of the people in a population will be your early adopters of whatever it is. The early majority are the next 34% roughly, and that splits off again into another 34% that are a late majority, and then about 16% will be laggards, which don't usually adopt whatever it is. So the laggards are really kind of way behind and stay behind. The early majority and late majority, and I would say we're probably somewhere in between early majority and late majority if you look at the pattern of diffusion of innovation around wellness. So if we think about the issue of adoption of wellness and we think about the populations and people that we're trying to affect, we can probably use this typology to think about how adoption basically takes place and what we might in fact expect to have happen. So Shoemaker and Rogers' effort at defining this actually sets a good boundary for us to think about how adoption of wellness would essentially take place in virtually any setting. Now let's look at some of the potential obstacles to wellness advocacy. And they essentially are around the area of a lack of knowledge. So if we are not very knowledgeable about many of the issues in wellness, that lack of knowledge can be really associated with the areas of public health. So we have a whole science base around how we affect the health of populations through public health kinds of activities, although public health has historically been oriented toward the vulnerable populations and the relatively rare situations that address the health of populations. So public health has been crafted and is oriented toward specific types of health issues. But in general, if we look at the broader base of public health, we're looking at the entire health of the population in a given area. The area of epidemiology is actually a technical area that allows us to look at what are the factors that are associated with morbidity. And morbidity is illness and injury. So we in fact can look at what are the factors that affect the pattern of illness and injury in populations, and what are the things which contribute to the increasing prevalence of those conditions, and what helps us reduce those positions and reduce those prevalences. So epidemiology is one of the areas, if you don't have a grasp of that, you're not going to necessarily see the value of wellness interventions. In addition, population health is another one of those areas, and that's the emerging field. It's developed over the last 10 to 15 years, where we in fact have done things to affect the health of populations. And so we think about what interventions might we do to in fact improve the pattern of lifestyle behavior, health risk issues, clinical risk issues, behavioral risk issues, and how to improve the health of a population. Prevention and prevention methodology comes a lot from the U.S. Preventive Services Task Force and the Community Prevention Services Task Force that are authorized under the ACA to set policy around prevention. So if we're not knowledgeable about what those groups have been doing, that in fact may contribute to my not wanting to support wellness from an advocacy position. Another one of the areas that I believe has been really not addressed very effectively is making the economic case for worker health. So that's where we are actually being much more astute about the collection of information, putting together compelling evidence, being able to present it in various forums that have to do with the cost associated with health plans, with our health coverage, our medical benefit coverage, with our sick leave policies, workers' compensation costs, disability cost, short and long-term disability, and presenteeism-related costs. So that economics of worker health, if you don't have a good grasp of that, you're not going to look at wellness in any kind of strategic way. And finally, the area of behavioral economics, which is a more recent intervention or a more recent initiative to essentially look at what affects behavior and how do economic issues come into play when someone makes choices. And the whole concept, there was a book called Nudge, and it was an advocacy on the part of behavioral economists that were saying we need to structure our benefits so that people save money, so that they look at their health, so that they take action to reduce their health costs. So it's looking at how we structure that architecture of choice and decision making that affect consumer behavior. So if I don't have much knowledge of any of these 6 areas, I'm not going to see the strategic value of wellness, and you're going to have to work harder to convince me that wellness is a good thing for me to do or spend money on. Now, more challenges that come along with our approach to wellness advocacy is we really have a general ignorance of health and its importance. So we don't really think about health in a way that's very either intuitively insightful about how people think about it and how they do something about it. So we're really pretty ignorant of the importance of health in terms of how it interacts with productivity, how it affects our taxation issues in terms of governmental activity, how much money we spend on Medicaid and what that does to our state budgets by reducing the amount we can spend on everything else. So there's a lot of general ignorance of health importance. There's also an ignorance of the economic importance. And it's not just the issues that have to do with those 5 areas we just mentioned in the last slide. It also has to do with how does this affect our deficit as a nation? What's our health solvency issues? Medicare is somewhere around a $34 trillion unfunded liability between now and 2020. So we've got some ignorance about the economic importance and how that plays out in terms of our society. We also have the ignorance of organizational impact. So we oftentimes don't really think about what's the impact of people becoming a better consumer, a health consumer, or becoming more confident about making decisions about their health. How does that impact how our organization operates? There's also the fact that it's not cool. So sometimes our wellness stuff is seen as kind of, the wellness police, or, why are you telling me what to do? And, this isn't cool. This isn't something that has value. It's not perceived as being of importance. It's also not my responsibility. So I also have that undercurrent. If I feel like my health is really out of my control and I don't shape it, I don't have anything that I can do about it, then I'm going to see my own health as not my responsibility. And then you don't get my attention because I basically tune you out because I'm thinking that my health is really determined by what the doctor does or my genes, or it's not affected by the behavior choices that I make each day. There's also another challenge in terms of not seeing the caring side of wellness. So sometimes we present wellness maybe from too much of an economic perspective, or we use too strong an incentive and we haven't put much of the caring side, the humanitarian side, involved and into the programs. So these are some of the more challenges that kind of go along with some of those points that we just mentioned a moment ago. And in addition, it's oftentimes not a big enough wellness team. So we maybe task one person or two or three people to have an impact on wellness, and that's just not enough threshold of effort and people whose interest is in this area to actually achieve much. So these are, again, some of the challenges that we run into in terms of wellness advocacy. Now, suggestions for effective wellness advocacy, I'm going to lay out as a series of steps. So the first step is refining and presenting the economic argument. And we're going to basically look at how you would do each of these with an intention that by the time you get through with all the steps, you essentially have probably been able to create a much stronger advocacy for wellness in your organization or community or culture. The second point we're going to look at is refine and present the humanitarian argument. So we have the economic argument and the humanitarian argument. The third step we're going to cover is develop your wellness messages and repeat them. So we need content that is message content, and it needs to be repeated so that people in fact get it. Number four is speak from a personal knowledge. So that means that we have to encounter wellness ourselves and speak from a personal knowledge level, because that's a pretty powerful way of influencing people and persuading people. So that's another one of the things we're going to look at in more depth. The fifth suggestion is to recruit some senior champions, which means that you don't just have one person that's your champion, but you really look for a couple people who can kind of carry this area as a concern, burden, interest area that they want to see some things happen in. So that's recruiting senior champions. Number six is challenge people to participate. So part of wellness is in fact giving people permission to do things that are healthy for themselves. And part of what we have to do in wellness programs is actually challenge people to participate, to become active, to engage, to become involved in their own wellness. And the seventh and last item is to invite involvement. So one of the things that comes into play in terms of our well-being and our relationships and influence in organizations, in communities, in groups of people is to invite people's involvement. Don't just do it for them. You ask them to get involved and do it for themselves. So we're going to look at these 7 suggestions for effective wellness advocacy. Now, the first suggestion had to do with refine and present the economic argument, and there's a couple pieces to that. This particular piece comes from national data. This is the best situation is when you have this data for your own organization, when you can look at the amount being spent on the health plan cost, and this is all per capita, per employee, per year costs, and it totals about $37,000. So we've incorporated several research projects and then put the data together to give you what is likely to be a rough depiction of how much of the economics of worker health are usually experienced by an organization. So we end up with about $13,000 of kind of average health plan costs per employee per year. The sick leave absenteeism is about 2,200. The workers' comp is about $873. That can be much higher if it's a work environment where there's a lot of worker injury exposure or worker illness, occupational illness exposure. And then the disability cost is about 1,400. And then the fairly large cost that you see here is the presenteeism related. And presenteeism is essentially productivity loss when I choose to stay at work, but I've got migraine headaches, or I've got allergies, or I've got a cold that I'm suffering with, or a reflux condition and indigestion, or severe headaches, whatever it is. So there's a lot of that going on, and it's fairly large. And so that's the issue of presenteeism, its measurement, and its economic value. So this is a context to kind of give you the basic starting point for getting management to support wellness. And that means you need to refine and present the economic argument in a way that relates to your organizational situation. Now, why wellness is not going to go away, and the source of this data is from the World Economic Forum, and it essentially says in developed nations of the world, including the US and including all of our trading partners that are part of the developed world, there are these 8 risk factors and behaviors. So we can look around the circle: poor diet, physical inactivity, smoking, lack of health screening, poor stress management, poor standards of care, of actually treatment care, insufficient sleep, and excessive alcohol consumption. Those 8 risk factors and behaviors drive the 15 chronic conditions you see listed from 1 to 15. So these are the major reasons why people are using they are chronic conditions that lead to healthcare utilization and healthcare costs. And those 15 chronic conditions account for about 80% of the total costs for all chronic illnesses worldwide. So that means that in our healthcare system in the US, according to Dorothy Rice and some of the other staff at the National Center for Health Statistics, about 70% of the $3.2 trillion spent in 2015 of our healthcare, 70% of that was for chronic illness. So 80% of that 70% is driven by these 15 chronic conditions. So we then walk those 15 chronic conditions back to these 8 risk and behavior issues. So this is the kind of information that if a senior manager grasped this, he or she would immediately understand, gosh, we got to be doing something to get at these risk factors. And that's where wellness and wellness interventions come into play. So this is part of that economic argument that says why wellness is not going to go away, why we need to be putting some more energy and focus on it. Now, a summary of wellness program ROI studies, part of the economic argument for health promotion and wellness, and I use the two terms interchangeably, has to do with what's the evidence for these wellness programs producing economic return. And for some 25 different studies that have gone to the point of actually calculating return on investment, these are the CB ratios, that's cost benefit ratio. Those are reported in integers, and they usually are set up so that you have $1 of cost, a colon, and then maybe $3.20 of benefit for that dollar of cost. So each of these, if you took study number 10, that's about a 3, let's just say it's a 3.6 cost benefit ratio. That 3.6 cost benefit ratio equates to 360% return on your financial resources each year. So these are the 25 peer review studies that have been done on wellness programs. And the basic argument here that you're presenting is, in addition to the large amount of cost involved in the issues that underlie wellness, We also have evidence in our literature that says these programs can have a very significant effect on the costs that we're encountering. And we can also look at the economic cost. None of these studies, 25 studies, looked at all 5 of the economic variables. Most of the time they looked at health plan cost. The second most prevalent was sick leave. But they only looked at one economic variable, not all the 5 economic variables. And we have a good deal of epidemiologic evidence from D. Eddington and David Anderson and Bill Whitmer at the HERO, Paul Terry, that has in fact documented that each of those 5 different areas, health plan, sick leave, workers' comp, disability, and presenteeism, are in fact created and enhanced and increased by the underlying health risk issues that wellness programs have historically attempted to deal with. So this is part of the economic argument that has to do with the first of the 7 steps that we've been talking about, and we'll talk about some more related to wellness advocacy. The second suggestion is that we refine and present the humanitarian argument for wellness. Before going into the data that you see in the table in front of you, I want to kind of highlight what that humanitarian argument is. And it starts with the idea that employees are important to the function of all work organizations. So we would not have work organizations that produce anything if we don't have people that are actually carrying out the work. So people have to play some sort of role. Even when we automate things, we still have to have people involved in the process. And the employer or the work organization is in fact saying, we value you as an employee, so we want to take good care of you and care of the people that are that human capital that are enabling us to carry out whatever function we choose to carry out. So if we're in a profit-making organization or a manufacturing company, or we're in a city government or county government or state government or federal government, or we're in a university, or we're in a variety of service organizations in the community, we still have this idea, the humanitarian argument, that we want to do something good for you because we want to help you take care of your needs. And it's also the right thing to do. We can probably say from a moral high point that it is an appropriate thing for us to take care of each other, to be supportive of each other. And that's what wellness attempts to do from a humanitarian vantage point, is to create caring work environments. All the literature basically says we all want to be in a place where people care about us and we can care about other people. So that's the humanitarian argument. Now, the data that you see represented in the table comes from the 2010 actually American Psychological Association's Psychologically Healthy Workplace Awards, and those are given to organizations that are doing wellness programs. And the findings that they came up with that year showed a 32% reduction in turnover. So the organizations that had wellness programs experienced significantly lower employee turnover. We also have data that the percent of employees reporting chronic work stress was actually lower in the organizations where wellness is being conducted and wellness programs are being conducted. The percent employees intending to seek employment elsewhere goes down. So we have fewer people wanting to leave, and that contributes to our retention issues. And then percent employees who would recommend their employer as a good place to work goes up. So that's basically people talking about the value of being rewarded and being cared for by the humanitarian side of the wellness issue. And then the last issue depicted in this graphic from the American Psychological Association is the percent of employee satisfaction. So there's actually an increase in people's level of satisfaction as employees about their employer. So these are some of the kind of more tangible qualitative and quantitative data that go along with the humanitarian argument. So that strategy for wellness advocacy, the second one we talked about, is to refine this and then present it. And it's just called the humanitarian argument for wellness. And it's part, again, of our advocacy approach. This third suggestion is to develop your wellness messages and repeat them. And these are the kinds of messages as you glance at the list here. I won't go over every one, but basically these are the kinds of messages we want to keep giving to employees to help them better understand what is being involved with the wellness program and what's the value of that to the individual. So what you see here is some of those statements, some of the messages that we need to be pretty consistent in being able to roll out to employees on a somewhat periodic or regular basis. The fourth suggestion is to speak from your own personal experience about wellness. And that just means that wellness is highly personal and it's universal. We all have to eat. We all have to exercise, or we deal with exercise in various ways. We choose to wear a seatbelt, or we choose to not smoke, or we choose to manage our weight, or we choose to use alcohol in a healthy way. So all these personal but universal kinds of issues. So I can take my personal experience and connect with the universal experience of people that I'm talking to. We never fully arrive at a state of wellness or well-being. We are working on it. It's a journey, and we want to recognize and give people permission to work on improving it over time, that it will in fact improve and that I can work on it as an individual. I also want to share personal stories and examples because they're pretty powerful. We connect with what other people are experiencing. So if you tell me a story about a person you've known or yourself and kind of relate that to me, that becomes a very powerful source of motivation, inspiration, sense of understanding. Personal stories also influence others. So if we are experiencing those stories and we tell somebody about them, that oftentimes influences their choices. And it also helps us put a human face on wellness, and that helps us connect more effectively. So if we don't just talk about the fact of your cholesterol level, we want to talk about how are you feeling about that and where are you going with it? What's your goal? Why do you want to have that goal? So we're putting that human face and we're using personal experience and stories to help us do that. The fifth strategy suggestion is to recruit senior champions. So we can talk about CEOs, COOs, Chief Operating Officers, CFOs, Chief Financial Officers, Chief Human Resource Officers, and those are usually the ones that are advocates for wellness. There can be general plant managers or general managers or regional managers. There can be union presidents. There can be senior VPs. So it's basically identifying who are my advocates, who are the champions for wellness, and can they in fact speak for the wellness issues and be involved in policy setting and resolving problems and talking about issues for a particular work organization or employer. The sixth suggestion is to challenge people to participate. So the idea that we want to explain the benefits to all from participation. It actually is a good thing for all of us to be involved in wellness, because what other people are doing in wellness are also influencing how much health plan costs they're going to use, how fast our premiums are going to go up, whether we in fact have enough staff because people are in fact out of work or not able to work for a health related reason. So you explain the benefits to all from participation. You can make a direct appeal. You can basically have your senior management group, maybe the chief human resource officer, the chief financial officer, and the chief executive officer all sign some sort of email that basically asks all of your employees to participate in the wellness program. We might in fact tell them what the wellness program is designed to do and why we're doing it. You can encourage people to experiment. So there's a level of experimentation. Most of us need to kind of try things out. So you want to encourage them to do that. You also want to help them compare to some of their past experience. So they can talk about, and you can talk about, how are you doing with your wellness? How are you doing at this time last year? What's happened from last year to this year about these issues? You can also begin some consistent communication with employees. So that's the challenge for us, to be giving messages that have to do with encouraging people to participate, to become involved, to become engaged. We can also challenge the workforce on participation goals. So if we wanted to talk about the completion of a well-being survey, and we wanted to get 80% of employees completing it, then I can report that back to people. I can say, we're at 60. I want to, encourage people that if you haven't done it, please go to the website, and complete it. So I can challenge a workforce on participation goals. And I can report the status periodically. So that helps me, in fact, give feedback that allows employees to see that other people are taking part in this. It's perceived as valuable. Therefore, I'm going to engage in it. So this goes along with some of our suggestions about challenging employees to participate in a wellness program. The seventh issue is to invite involvement, and that means to create a role for wellness ambassadors. So we may in fact have people that are our contacts in various work units, maybe in different geographic sites, maybe in different organizational units. But it's someone who is that wellness ambassador, sometimes called a wellness rep, sometimes called a wellness leader, team leader. It can be called a wellness champion. So lots of different names for it, but it's creating a role for people to be involved in the program. You can enlist involvement, so you can ask people, do you want to be involved? You can develop more volunteer roles. So maybe there's some roles that you can define for people to participate in the program itself, as maybe maybe a leader, a team leader for a wellness team that's competing with other wellness teams in your employee population. Or it's someone that maybe leads a group of walkers and gives an orientation to a wellness kind of path around the physical work site. So there's lots of different things. Maybe it's a leader that does some stretching and some flexibility work with a work group before they go on shift. So lots of different volunteer roles. We can rotate advisory committee positions. We oftentimes want to have a wellness advisory committee to help us with the program, but also provide feedback and be some of the hands, arms, and feet and eyes for your program. So we can rotate that advisory committee positions. We can also create more self-directed project team approaches. So we can basically say, you come up with a wellness program that has these 4 components in it, and you design that for your group. And that becomes, you become a self-directed project team around wellness for your particular group. And then we can also look for expansion of roles and responsibilities. So we can look and see what are some things that employees could do that would augment the program. Maybe a wellness mentor program, so that people can mentor others that are working on a similar issue. So lots of opportunities for that kind of thing. But it's basically inviting involvement from employees in the program itself. Now, a summary of key points. We went through 7 different strategies for wellness advocacy. There are several major reasons why wellness needs strong advocacy. It will not get by if the advocacy is lukewarm. This is where we say to people, you need to have some passion about this. You need to kind of be able to stick with it and help people kind of get out of their plateau or get out of their stuck position. Advocacy requires knowing what is important to the organizations and the people involved. So we want to know what's important to them. How do we relate the wellness issues to a particular group or a particular individual? And then the fundamentals of advocacy are similar to the basic sales process. What we're doing in advocacy is really sales. And that sales process, we looked at those 3 major steps. And those are the basics of the sales process. Wellness needs a lot of advocacy. So for all the reasons that we identified, wellness really needs a lot of support and advocacy. Ignorance of the clinical and economic details of wellness are one of the most significant challenges to the field. So that's what keeps a lot of people stuck. They plateau out because they don't have either the clinical, behavioral area, the epidemiology, or the economic details of wellness and the economics of worker health. Advocacy for wellness needs to have a strong reliance on the economic realities of worker health. My experience has been you do the best thing you can to help a wellness program be a long-term effort if you can build a balance between the economic and the humanitarian arguments. You don't want to load up all of your reason for being onto the humanitarian side, or conversely, you don't want to put it all on the economic side. You want to work both of those issues in a way that's a balanced kind of approach for that organization. It also needs a clear humanitarian rationale. So it's the money by itself is not sufficient. There has to be the caring issues, the concern for people, the desire to help them be as well and as healthy and as productive as they possibly can. The core messages of wellness need to be repeated often. So those messages you saw in the second or the third, suggestion in terms of strategy. And when you speak from personal experience, it's also a powerful strategy for advocacy. We influence people when we speak to them about our own experience. Advocacy requires the development of champions and their influence. So we've got to have people that are out there kind of representing this and being able to speak about it. There is a need for challenging employees for participation and for their experimentation and involvement. So we can invite them to be involved in a wellness program. Now, let's look at some key questions around this module. First of all, why is advocacy needed? And I believe there are four major reasons. We touched on them, but I want to craft them in a little more direct way and say that our culture, the American culture, is heavily treatment biased. And that just means that we, as a rich enough country, we have the orientation that I'm going to do whatever I want, and when I get sick or I get injured, I'm going to have somebody else fix it for me, and I'm going to have somebody else pay for it. And that's the orientation that we have. The second issue is we are in a healthcare system that employs some 13 million people and actually consumes somewhere around $3.2 trillion in 2015 that is revenue driven. And that means that our healthcare system is oriented toward not keeping people well, it's being able to make money off of the illness and injury that exists in the population. So our healthcare system is in fact revenue driven, and prevention doesn't necessarily drive a lot of revenue. It drives some revenue, but only a small proportion. Most of it is treatment oriented, and that's where the money is. And the third issue is it's difficult to do. So advocacy is needed for wellness. We actually parse that out in several major ways by being able to show you why it's so difficult to do. But it is difficult to do. And the fourth reason is it requires an element of deferred gratification. So we have to be advocates of wellness because wellness takes effort. It takes some time to develop a habit and to actually change some of our numbers and some of our stats and to change our diseases and the prevalence of conditions and symptoms and so on. So it has to have some deferred gratification. So those are the four reasons that I would suggest that advocacy is needed in wellness. And again, treatment bias, revenue-driven healthcare system, difficult to do, wellness is difficult to do, and it requires deferred gratification. We don't do well with deferred gratification. We're very immediate gratification oriented. The second question is, when does advocacy take place? And I think advocacy actually formally takes place anytime money or support is needed. So whenever we're talking about budgets, whenever we're talking about support, and that, by the way, can be support for policy change, it can be personal involvement support. So managers are actually taking part in the wellness programs and being seen as supporters and advocates of wellness. And it also takes some advocacy and support needed to change the physical environment at work. So if we're going to put in a quiet room, put in bike racks, or change the way in which our walking trails are labeled and measured. You know, those are all physical environment kinds of changes. And the supportive environment means we have all three of those things going on. Policies that point us toward wellness, involvement of key managers in the wellness program, and physical environment changes that take place that make it easier for me as an employee to engage in wellness initially, and also to practice the wellness that I want to achieve over time and develop the habit that is a healthy habit in place of an unhealthy habit. The third question is, what does the future for wellness advocacy look like? And I believe that we have a lot of more opportunity ahead for advocacy. And I think that it's due to a lot of the uncertainty around the recent election, and the way in which the ACA is structured and what is likely to be happening over time in how we address health as a nation. I think there's also the issue of health solvency. It's a concept that Michael O'Donnell has developed with the American Journal of Health Promotion. And it basically says if we can affect a very significant, major portion of our deficit as a nation by being able to get people healthier. If we can help them be healthier, not have as many chronic diseases, not have as many symptoms, not have as much disability or pain and discomfort, or premature death, we're going to affect our solvency, economic solvency as a nation. And that's just called the health solvency issue. So you can search on your browser for more information about that. The third thing is we have the phenomena of conservative ideology and liberal ideology. And the conservative is going to be uncomfortable with the federal government growing. And on the liberal side, the liberal basically says, let's get the state to do wellness for us. So let's spend a lot of money. We'll take it from the people that have it and actually give it to the other people, and then they can be more well. Their well-being can be improved. So we have this dynamic going on about our statism, what role the federal government plays in things like wellness. And we have the conservative ideology saying, let's not spend tax money doing wellness. Let's figure out how to do it in a private marketplace. At the same time, the conservative ideology also says, let's maintain a high level of freedom. Let's not require people to do things, because when we require them to do things, the basic position we're taking is we know better than them, and they ought to do what we say that they should do. And that's a problematic situation for us. So we have the conservative and liberal viewpoints in conflict over the funding of wellness, over the issues of whether we make wellness policies through the EEOC or through other federal agencies. So we've got a lot of the future of wellness advocacy is going to be shaped by the undercurrents that take place in terms of our political environment, and then how these other areas work themselves out. So more opportunity for advocacy, I believe, is coming. I think we're going to have more opportunities to make a case for people to actually engage in wellness and to support wellness from employer perspectives particularly. Now that you've completed this particular module, go ahead and take the quiz.